All right, April, thank you. New at 3 in Mississippi, the Medicaid tech bill recently failed to be signed into law. The bill would allow for Le Bonheur to once again receive a special payment for caring for Mississippi patients covered by Medicaid. Le Bonheur is currently the second largest provider of care for Mississippi children and serves more Medicaid patients than almost 80% of the hospitals in Mississippi. Here to talk more about the bill and how it could impact Mississippi families is Le Bonheur's president, Dr. Trey Eubanks. He's joined by Katie Kruger, a Mississippi resident whose daughter receives care from the hospital. We welcome you both to News Channel 3 at 3. How have you been today?
Been great. Thanks, Alex.
Good, Katie. Good to see you as well. Doctor, let's begin with, before we get into the Senate Bill 2386, let's talk about the care that so many families and children in Mississippi receive from Le Bonheur.
Well, Le Bonheur serves obviously a three-state region, mostly West Tennessee, but also Northeast Arkansas and North Mississippi primarily. We get patients from all over the country, but those are the three areas we get most of our patients. And if any day you walk through our neonatal intensive care unit, for example, 1 out of 4 children up there is going to be from Mississippi. So we see a lot of people from Mississippi. We love taking care of the kids of Mississippi. We're one of only 2 level 1 pediatric trauma centers that serves the children of Mississippi, in addition to University of Mississippi in Jackson. So it's part of our rich heritage, taking care of the people of that area.
And of course, you are a native Mississippian
I am
yourself.
from Tunica.
This bill has really kind of grabbed your attention. Why so?
Well, we have been in this program for several years, and recently, unfortunately, we're removed from the program, and it's a big impact to us because the program allows for hospitals like ours who care for Medicaid patients from that state to be able to provide the best care. And since we're not going to be included in the program as things go right now, it's going to really hurt our ability to continue to provide the best care for those children from Mississippi.
Definitely want to bring Katie in right now as well. Katie, we've had a chance to meet you and your beautiful family during some of our Go Jim Go family patient profile stories in recent years. Tell us about the impact and the importance of Le Bonheur into families like yours in Mississippi.
So our story with Le Bonheur really began as we were moving to Mississippi from California. And Le Bonheur ended up being our second hospital to go to because we needed an MRI for our daughter. She was having seizures and other concerns as a 6-month-old. Unfortunately, the first hospital that we worked with couldn't see us, and it was a significant period of time with those concerns for our child. We called Le Bonheur and they had us in there the next day. And they've been that way ever since. She's now 10, and Le Bonheur...
How's she doing, by the way?
She's doing great. She's busier than I need her to be.
But without Le Bonheur and the type of specialized care that Le Bonheur provides for so many families, so many children, what would that mean, though?
I would say that Le Bonheur didn't just save Annabelle's life, they gave her life. And so having access to the specialized care makes a difference in the child you have and the child you could have.
That says so much. It really does, Katie. Doctor, I was reading more than 30,000 visits from Mississippi children every year at Le Bonheur.
Right. Yeah, we see a lot of children, about 18,000 that are Medicaid patients every year. And we want to continue to be able to do that.
Yeah.
And so we need to partner with the state of Mississippi to do that, and that's part of our concern here.
So where do we go from here with maybe some of the conversations you're having with state lawmakers in Mississippi, maybe the governor? What are you hoping for?
Well, I would love to get in front of the governor and talk to him about the importance of it. I'm sure he has a lot of things on his desk, and I'm not sure that it was all that the concerns about this bill were really around us, but other things, politically speaking. But we've got a lot of families that are reaching out to us, like this family, concerned about what's going to happen with this change in legislation, and we're just being responsive to those concerns. A lot of those families are reaching out to their local representatives to express those concerns, and we'll see how that goes.
Is that important to do for those families, especially those watching this now, to reach out to those state lawmakers and perhaps even the governor?
Absolutely, and we would welcome that, and I think they need to hear from their constituents, obviously, about what their concerns are. They want to be able to provide great health care for children. That's what we want to provide as a partner institution, and so they need to let their representatives and the governor know how important that is to them.
Dr. Eubanks, I know you're keeping your fingers crossed. If this doesn't happen, though, are there any potential safety nets out there for those families if they cannot depend on Le Bonheur.
Unfortunately, we are the safety net. And so if this doesn't happen, they will still be trying to come to our front doors, and we'll be taking care of all those patients as we always have. The deficit that won't be overcome by the funding will be hard to overcome this year, especially as you know, healthcare is struggling across the country. And for us to be able to provide high quality care, we really need to partner with all state Medicaids to take care of patients in need.
And Katie, I'll let the last word be yours. If the governor, if some state lawmakers were sitting right here now, what would you want to say to them?
I would ask them to think about their children needing care and having as many resources as possible, have the availability to get to them, to get the care they need, the kind of care they need, and to just think about that for a moment. We've all had sick children, so reflect back on how you felt in the moment.
Hopefully they will listen to what you had to say. Katie, thank you. Good to see you. Tell your family I said hello. Dr. Eubanks, thank you as always.
Thanks,
Good
Alex.
to see you.
Appreciate it.
All right.